Welcome to the Tradies in Business podcast with your hosts Warwick Bidwell and Nicole Cox. Divert your phone and grab a brew as Waz and Nick unpack tips, tales, secrets and stuff-ups from guests both inside and outside your trade, helping educate and inspire you to break the cycle of gut-busting and money stress and create a true trade business.
G'day, Waz. How are you?
I'm good, Nick. Although my back's a bit sore.
Oh, you're hunching there a little bit. What's going on?
I don't know. I think I picked up something wrong in the yard the other day.
Easy done.
Yeah.
We've
That
got
was
an interest.
terrible. But it relates to our guest, doesn't it?
It does. We've got a really interesting guest coming up today. I was fascinated by today's chat, actually. Really excited to hear a lot of what he had to say. It's really groundbreaking. And in fact, I think he's probably one of the most unpopular people in his industry.
I love talking to disruptors like Dave.
Yes.
Because they're marked men and women, really. They're out there pretty much calling into question a lot of what has become accepted truths within an industry.
Yeah,
that
agreed.
aren't necessarily true. It's just, whether you look at nutrition or, drugs or different trades, building methods, whatever, there are things that just get accepted as truth and fact, and in reality, they're actually not.
That's right. And the way we've always done things isn't necessarily the correct way. So it's time to, at least listen to these people and have a think about what they have to say, yeah?
Yeah.
We don't.
I agree. And I think what it does is it gets us to actually start asking some different questions. Mm-hmm. And so, listeners, in case you're wondering, and before we jump into the interview with Dr. David Johnson, who you'll hear us intro, we are talking about back pain today on the episode. And look, it is something that affects a lot of tradies and honestly just a lot of people because we spend a ridiculous amount of our lives sitting down. And as I say that, I'm sitting in my chair in front of my sit-stand workstation, which even though I've got a sit-stand, it probably still spends more time in the sit than it does in the stand, which is dumb. But I do stand up at it quite a bit. And we sit down a lot. We use our bodies in ways that probably aren't as efficient and effective as they should be. And as Dave said, like back pain is what did he say? The biggest productivity
the leading
killer in Australia.
Correct.
Or something?
Yes.
It's
and
insane.
also then we went to talk on about, there's some amazing stats in this interview. It's
frightening stuff.
Well, it's very scary. It's really scary. And yet there's some really great news for tradies. It's as simple as that. There's some really good positive parts of being a tradie.
Yeah, and like by the end of the interview, I was like, oh, wow, it's actually really simple to fix.
Yes, very simple and not expensive.
No. And as he says, he actually doesn't make much money out of giving this advice. So
no. And he's on a mission to make himself broke. Isn't that what he said?
Yeah.
Run himself out of business.
He's trying to put himself out of business, which, yeah. So have a listen to Dr. David Johnson. It was a cool interview. He's a very passionate man. And I love talking to people who are just, almost evangelists for the cause.
Absolutely.
But well worth a listen. And look, if you or anybody you know has any issues with back pain or neck pain, or really just any physical pain issues, chronic pain issues, you really need to have a listen to this and go check out some of the resources at the end.
Agreed. Enjoy.
So joining us on the podcast today here at Tradies in Business is a man by the name of Dr. David Johnson. Very officious. We've never had a doctor on the show. Welcome to the podcast, Dave.
Thank you very much. Thanks for inviting me. It's an honour to be invited onto the Tradies podcast. I've just heard all about it. Sounds like you're doing a great thing, so I'm delighted to be on the show.
Thanks, mate. Thanks. Now, I always feel weird referring to a doctor by their first name and not by their pre-nominal.
No, I don't like being called doctor. Actually, I don't like being called doctor. Dave's fine. Dave's absolutely fine.
Dave works better for our listeners too, man. I think if we say Dr. Johnson for the next 45 minutes, people are going to get really sick of it.
Yeah, absolutely. Let's stick with Dave.
All right. So tell us, mate, you are a doctor, and what are you a doctor in, and what's your experience, mate? And I mean, we'll obviously dig into what we want to talk about on today's show, but kind of give us a bit of your backstory, mate.
Yep. So I am a neurosurgeon, trained in most of the tertiary hospitals around Queensland, and a little bit of work overseas as well. But currently I'm working at the St Andrews Private Hospital in Brisbane City, Spring Hill, and our surgical practice is called City to Coast Neurosurgery. Primarily because when we first started out, I did a lot of work on the Sunshine Coast, and also, but our headquarters was in Brisbane, and so most of my patients were either Sunny Coast or Brisbane. But now we've sort of really established ourselves at St Andrews Hospital, and my area of interest is really in relation to spine health, so neck pain, back pain, thoracic pain. And really a multidisciplinary approach to managing that, because it is a fairly complex problem of pain, and you really have to have, in tradies terms, I suppose you could say, you need to have multiple hammers. If you've only got one hammer, everything looks like a nail, is one of the things that we say. And in terms of people suffering from chronic back pain, it's a very complex problem. So you've got to have a lot of tools to address those complex problems. And we've established I really call it a centre of excellence in back pain management up here at St Andrews Hospital, with our own form of rehabilitation, our own form of pain management. And obviously the surgery side of things is what I do. That's my little part to play. And also training up our staff. I think we've got about 10, I think we've got nearly 10 staff members now that are part of the rehabilitation of patients with back pain.
Yeah.
So, let's talk about back pain with your listeners. I'm sure there's going to be heaps of tradies who have back pain. But does that answer my? I think
you've passed the introduction stage, mate. You've done well. So it is true. I mean, my dad suffered from back pain, probably for as long as I remember. From his 30s, and even now, he's 75. And he has a lot of chronic pain, a lot of back pain. He hasn't got herniated discs or anything like that. But he just has a lot of pain, and he's taken painkillers for probably 30 years. He was a builder, physical worker, manual labourer, and I guess it's a common story for a lot of physical workers that they end up with this back pain, and whether it's between the shoulders or neck or lower back or all of the above. And it seems to me that, like anything, I guess, there's a lot of misinformation and misunderstanding out there about the problem and then the solutions. What is the problem, David? I mean, I know you're not going to be able to sum that up in less than 37 minutes, but
that's you've actually absolutely nailed it on the head there. There's a lot of misinformation. There's a lot of misinformation that is being put forward by different elements of the back pain therapeutic industry. Okay, if we don't want to name and shame anybody, but if we just say the back pain therapeutic industry, and that can be doctors, that can be specialists, spine surgeons, musculoskeletal physicians, physiotherapists, exercise physiologists, the whole works, right? Massage therapists, chiropractors, osteopaths, acupuncturists, prolotherapists. And now I've just listed off, without taking a breath, about 20 different methodologies that are associated with back pain. Now, you can immediately judge from that if there are that many types of approaches to managing back pain, there's a significant problem with the conceptualization of what causes the back pain.
Yeah.
And so that's part of the thing. Just Google back pain therapy and you're going to get 5,000 hits of what to do. And some of them just make no sense at all. Some of them have elements of science blended in there. But it tells us that as an industry, we are not really we haven't got our heads around root cause. Okay, if you've got a brain tumor, we know you could go to surgeon 1 in Townsville and surgeon 2 in Melbourne, and you're probably going to get a fairly similar answer about what you need to do. Okay, you can go to GP in Townsville, GP in Melbourne. They're probably going to send you along the same path of management. Whereas if you have chronic back pain, like your dad or your next door neighbour or your sister or your brother, it's so prevalent. That person's going to go to an individual that they Google, and their management will be chalk and cheese. Okay, one person will say just rest it out. One person will say take this tablet. One person will say you need Bowen therapy. One person will say you need an adjustment. One person will say you need to strengthen your core. And that's sort of highlighting what the issue with back pain is. And as the years have gone by and watching the research, the World Health Organization has come out this year in a statement saying that back pain is the leading cause of disability on the planet.
Wow.
And it's one of the most common reasons to visit your local doctor. Right. And in terms of economic health burdens, it's one of Australia's top economic health burdens. So every dollar that you're paying in tax, a significant proportion of that goes to people with back pain.
Wow.
And these are undeniable stats. And so my mission is to try to get out there a rigid construct for the root cause of back pain. And if everyone understands what the root cause of back pain is, we can now then start to implement a replicatable management strategy.
Yeah.
Okay? And that's what it sort of boils down to in terms of why is the problem so prevalent.
With such a complex issue, then, when we're talking about so many different ways in which we can, I guess, present with back pain, is there any one root cause or is there any one solution that can be applied as a blanket ban for everybody?
The complexity of back pain a really downstream phenomenon. Mm-hmm. Okay, so if you sit down with someone who's had 10 years of back pain, it will immediately appear very complex. Mm-hmm. Okay. But if you wind back the clock in their history, it gets simpler and simpler and simpler.
Yes.
And so that's when it becomes more funneled in towards a root cause for symptomatic degenerative back pain.
Sure.
So it can be complicated and say, okay, so say someone has an immune disorder like HLA-B27 autoantibody. Okay, mm-hmm. That's an immune condition that someone might have. It's very rare, like we might say 1 in 50,000 or something, and so that person might get back pain because of that autoantibody, and we call that we give that a name. We call that ankylosing spondylitis. Mm-hmm. Okay? But the vast majority of people, like this is where the low-hanging fruit is, the real problem. It really does go back towards a single root cause, which I build my management paradigm around. And I say to those patients that don't have these rare things, the driving root cause of your back pain symptoms is movement dysfunction. Movement dysfunction. It's a little bit like saying, why do most car accidents occur? It's not because the wheels are falling off. It's not because of low oil, or it's not because the brakes are failing. It's because the driver is not controlling the vehicle well. And so if we think about what that means in terms of the human vehicle, it's not driving the human vehicle well.
Sure.
Movement dysfunction means I'm not driving the human vehicle well. Now I'm going to get certain structural breakdown in my human vehicle. And now the complexity starts to become apparent, this perceived pseudo-complexity, where, okay, now what is it that's broken now? Is it my sacroiliac joint? Is it my facet joint? Is it my insertional tendinopathy? And now it's started to look complicated. But if I and a bit like how a motor vehicle would have a structural breakdown. So if I'm driving my vehicle poorly, now what is it? Is it the wheel alignment? Is it the wheel balance? Is it the fan belt? Is it the oil? And it becomes complicated, and so you have to take it to a mechanic. But if we wind it back and say, okay, let's drive it really well. Now we're going to get 50,000 K out of the tyres. Now we're going to get a full 10 years out of our motor car. Yeah. And we can do the same with a human vehicle, because biomechanics in the human body is no different to biomechanics in non-biological systems.
Yep.
Okay. The musculoskeletal system behaves in biology like a fulcrum and a lever on a crowbar. So the same principles have to be applied in back pain health as well, in spine health as well. So my message is move well, prevent biomechanical stress that transfers into biological inflammation. Biological inflammation creates pain and disability and structural breakdown. If you don't eliminate the biomechanical stress, you're going to get structural breakdown. And then the surgeon's going to have to do something, okay? Because the surgeon is like the mechanic.
Yeah.
The surgeon is like the mechanic. And the whole industry is very mechanic focused, not driving instructor focused.
Yep. It's treatment, not prevention.
Yes.
That's exactly it, right? We're all there. Okay, so you've got symptoms now. Let's massage your back, and let's do some acupuncture. Let's inject a bit of cortisone. Let's take some anti-inflammatories or opioids or endone, all these drugs. These are all targeting downstream problems. But if we actually said, why do you need endone? Why do you need a massage? Why do you need an adjustment? Because you're moving the human vehicle poorly.
Yeah. And
we send you to a human driving instructor, you've immediately got to the root cause of the problem, the seed. And when you eliminate the root cause, there's no more need for those downstream therapies. Yeah. It's pretty ironic, but I want to eliminate the need for spinal fusion surgery. That's what I do 2 days a week, is spinal fusions. And my mission is to eliminate the need for spinal fusion surgery. I want to put myself out of business.
Yeah. How many of those that you, and I know this is going to be perhaps a difficult question to answer, David, but how many of those could have been prevented had they, traced it back to those movement dysfunctions?
I think the vast majority. I think there's incidents where you have trauma. Okay, so you can divide trauma into macro trauma, getting hit by a truck.
Yep.
versus micro trauma. Okay, so micro trauma just happens slowly over years and years. Okay, if I get hit, but the end result of years of micro trauma is the same as the end result of I got hit by a truck. Okay, it just happened in 1 second. But the end result is structural breakdown, and that micro trauma can be prevented if you get it in time. Obviously, if you fall over, have a major disc prolapse from structural trauma or fractures, then yes, you know, that all happens so quickly that you didn't get time to prevent it. And so therefore you need to repair the structure with surgery. But that's, you know, if you compare how many people are getting hit by trucks versus how many people are getting back pain because of a 10-year or 20-year history of moving poorly on the work site, moving poorly in the kitchen, moving poorly in the lounge room, you know, it's going to be chalk and cheese in terms of statistics.
So those micro traumas, David, what are we talking about? Are we talking about, you know, picking up a heavy load and tweaking my back, or is it even smaller than that?
So we probably bend about 5,000 to 10,000 times a day. And whether it's just a subtle bend, like I'm just bending forward to pick up this pen on my desk, or whether I'm bending forward to pick up a bag of concrete, a cement, bag of concrete, 20 kilos, for instance. In actual fact, the number of trivial bendings, okay, just bending forward to brush your teeth, pick up the TV remote, pick up the newspaper, put something in the dishwasher. Those trivial bendings that you don't even think about far outweigh the 20 kilos, 50 kilo lifts at work. And so in terms of the damage that's done, it's actually more likely to be represented by those trivial movements. And there's a different stimulus that the brain receives when you see something heavy. When you see something heavy, your brain goes heavy, brace, keep a neutral spine, bend over and pick it up. You still may not be picking it up perfectly, but you're starting to put in place safety mechanisms, inbuilt safety mechanisms that protect the spine in those situations. But when you see a handkerchief or a paperclip, the stimulus of that creates a different motor pattern, and so you will more likely move poorly. And that is going to slowly over time create the micro trauma that creates the biomechanical stress, that creates the biological inflammation, that creates the structural breakdown, pain and disability. But when the injured worker goes to see his doctor, what does the doctor say? He says, "You've got back pain because you've got a physically demanding job." And it's the wrong paradigm. And that's what that's part of the misinformation that exists out there. And I have to retrain that into my patients. Hey, I'm more worried about the way you're moving in the kitchen than the way you're moving at work. And if I train people to move well in the kitchen, the lounge room, the bathroom, and at work, then I'm actually rehabilitating someone 16 to 18 hours a day versus a visit to the local physiotherapy studio where they might lay down on a couch and get a bit of a rub down, a hot pack, maybe a bit of dry needling, and then get given some exercises, and then off you go. That's like 1 hour max. It doesn't have the power. It doesn't have the power to actually eliminate movement dysfunction. In contrast to, I'm going to move well. I'm going to move well as my default. That's exceedingly powerful on the biomechanics of your spine, and that's how we then start to reduce inflammation. When we reduce inflammation, we reduce pain, and we can then build capacity on that nice solid foundation of movement proficiency. But if we don't have a solid foundation of movement proficiency, we can't ever build capacity.
So it's fascinating because I like you, David. I do well, not as much as you, but I do a bit of CrossFit training as well. I'm a level 1 trainer. Pretty passionate about my functional movement, my CrossFit, and I watch people in our gym pick up a barbell and they do it really well, and they, like you say, they brace their back and the shoulders are back and all that sort of stuff. But they go pick up a broomstick to do some warm-up exercises, and they pick it up like a sack of potatoes, I'm forever drilling people on it.
Here we go. This is their spine when they pick up the collars in the bar. Okay, so they pick up the collars like this, but when they actually go to do the squat or the deadlift, they're perfect. Right?
Yep.
But that's exactly right, because they haven't retrained the motor patterns to move proficiently with trivial tasks. And there's not many people that are actually trying to teach that paradigm.
Now you've got,
that's a great observation.
You've got a training facility within the hospital there, which is essentially this is an opportunity for all the haters out there to have a crack, but you've essentially got a CrossFit gym inside a hospital.
Yep. We do have a registered CrossFit affiliate, but in terms of the clinical side of it, it's referred to as the Functional Movement Training Centre.
Yeah.
Okay.
Yep. Is that like the first of its kind in Australia or something, Dave?
It is the first functional movement training centre in the world, based in a hospital. Okay? Every hospital has physiotherapy.
Yeah.
Okay? Every hospital has occupational therapy and that sort of stuff. But in terms of specific and distinctive movement therapy and training people to move biomechanically proficiently, we are the first in the world to deliver that.
That's awesome, mate.
And so, I think we're sort of rewriting the textbooks a bit in terms of how to try to get on top of this epidemic, epidemic of back pain. It is an epidemic.
So, Nick, you go, because I'm hogging the mic here.
You're on today. Dave, I'm really intrigued about the process of teaching people to move functionally. I have some experience in CrossFit myself, so I understand the basic principles. But when you are teaching, let's use a tradie for an example, it's probably a concept that they're not familiar with. It's something new. How are you teaching them to do that? And then what are the steps that we can use to implement this in our daily life?
Okay, well, before I logged in, I was talking to a fitter and turner. Okay, he was a fitter and turner, and he had an injury in 2017, just a very trivial injury, and then he was put off work for a few weeks and given some massage therapy. And what else did he do? That's right. He got told to do some core strengthening.
Right.
Okay, so to most people, you'd think, oh, well, a bit of massage, that's not too bad. A bit of core strengthening, there can't be any harm in that. And so, if he diligently participated in this advice, and then he felt like he got better. He felt like he got better. Sure. He got stronger. He felt like he was stronger. But now, 2018, 2 months ago, he's in the exact same situation that he was in 2017. Now you'd have to say, well, why has that happened? If he's done something, if he's taken this advice on board, why has he re-injured himself again, just bending over to pick up a bolt?
Yep.
And the reason is because the massage and the core strengthening did not upskill his motor patterns.
Yes.
Right? So you can be Mr. Universe. You can have muscles on muscles, and that does not mandate proficient movement. Okay, that's really important. So you can. This whole theory about core strengthening to improve back pain is absolute nonsense. It's absolute nonsense. Like, when someone with back pain knocks on a Pilates studio door and says, "I've got back pain, can you help me?" and 6 months later, what do they leave with? They leave with a stronger core, but they still have back pain. Okay, so there's the one hammer. I've got one hammer. All I can do is strengthen people's core. And so what this patient, this veteran Turner, is going to do now, he's going to participate in a specific and distinctive movement therapy program that starts in week 1 with basic awareness of neutral spine positions, hip-centric rotation, posterior kinetic chain activation during movement, unloading of the knees, and him knowing what his proficiency limited range of motion is. So range of motion, if you try to exceed what your range of motion capacity is, you immediately fall out of good positions. And so patients need to know, well, okay, I can't bend over and do a nice squat to pick up a nail on the ground, because if I try to do it that way, I'm going to fall out of good positions. Whereas if I then say if I have to do that task, and I do what we call a knight's pose, where you put one leg, it's like a single leg squat or a lunge, and I put one leg in front of the other, and I slowly lower my opposite leg, and I maintain that same neutral spine position. I hip-centric rotate, and I posterior chain activate on that forward leg. Now I can achieve the task, and I have the adequate range of motion, and I haven't fallen out of positions. So that then adds towards building my spine health again on that foundation of movement proficiency.
Right.
Everything we do has to be built on that foundation of movement proficiency. And our program just develops that slowly. It's not something that you can learn overnight. You can't learn that in 1 week or 1 hour. Okay? And no different to if I said to you, Nick, here's a violin. I want you to play me an awesome little jingle tomorrow, right? But if I said to you, here's a violin, we're going to give you progressions.
Yes.
And I want to hear something pretty decent in 2 or 3 months. And you work through those progressions, and then in 2 or 3 months I come back and check up on you, and then you whip it out and, whoa, that's awesome. All right? Because you've progressed.
I would still suck after 2 or 3 months.
Exactly, yeah. And it's hard, but other, some people find it. Some people are naturally able to develop those motor patterns.
Yes.
And in fact, playing the violin is just a motor pattern. It's a motor pattern that I know how to move my fingers. I know how to move my hand. It's a motor pattern, and I'm training your brain. The exact same motor, we need to do the same and extrapolate motor patterns into daily life activities.
Right.
And what I don't know whether you know, I've coined the term the sport of life. And the sport of life is a sport that we're all participating in. You, me, everyone who's alive is participating in the sport of life, and we should be good at it to have a healthy musculoskeletal system. Now, if you want to be good at golf, go and perfect the sport of golf. If you want to be good at playing the guitar, perfect playing the guitar sport. It all comes down to motor patterns. Now, I don't really care whether I'm good at the guitar or good at golf, but I want to be good at the sport of life. So I'm going to work on those motor patterns that make me express those movement points of performance that we just mentioned. So hip-centric rotation, posterior kinetic chain activation, neutral spine awareness, unloaded knees, and proficiency limited range of motion. That's it. 5 points. And if that becomes default for you, I can almost guarantee you that the number of spinal surgeries that need to be done in this country and the world would probably plummet. There would be companies that go bankrupt.
So you would be a fairly unpopular man in your industry, I suspect, David.
Yeah, I would be pretty unpopular because back pain is $100 billion industry.
Yeah.
Okay, have you guys read the book called come across a book by Catherine Catheryn Cathryn Rahman. It's called Crooked. I think it's called Crooked, and the subheading is the $100 billion back pain industry.
Wow.
Yeah, right.
And that would just evaporate if people moved well. And interesting, you both said you did CrossFit. When you learn to do a deadlift well, you know what you're applying? You're applying those 5 points of performance.
Yep.
Hip-centric rotation, neutral spine awareness, unloaded knees, posterior kinetic chain activation, and proficiency limited range of motion.
It's fascinating to, I guess, see the misunderstanding in action as well. I recall a personal example with my parents when I helped them move house. So they'd been in the same house for 40 years. Dad built the house, and that's where I grew up as a kid. And about a year ago, they sold, and so I had to go and I didn't have to, but I went and helped my parents clean up 40 years worth of my dad's hoarding, right? And there was some big heavy blocks of wood and all sorts of stuff around, and I went to pick one of these up. My dad used to be a very strong, powerful man. You know, he's 5'4", in his prime, in his 40s, and I just always remember my dad being strong and muscular, but he's always had this pain. And I went to pick this block up, and it probably weighed, I don't know, 30, 40 kilos, and I squatted, you know, knees tracking out over toes, weight back over my heels. You know, I went to pick it up between my legs and squatted right down, cuddled it, and then went to stand up with it. And both of my parents yelled at me. They're like, no, stop. You're going to give yourself a hernia. I'm like, no, this is how you pick heavy stuff up. They're like, no, you got to keep your knees together and bend your back. And I'm like, no. That's why you have trouble with your back.
And so they've been taught, in fact, this is workplace health and safety guidelines.
Yes.
Okay. Now that is incorrect. Where does this come? This comes from Virgin Australia,
or any airline, to be honest, right?
Yeah. Well, it's on worksite posters. It's on safe lifting infographics everywhere. But can you imagine doing a deadlift like that?
That
Can
person's
you imagine doing it?
going to explode their knees.
Correct. So it's breaching those five movement points of performance that form the foundation of functional movement training. You know, because it's knee loading position, and it immediately deactivates the posterior chain. If you bend your knee like that, you've deactivated the posterior kinetic chain. And if that becomes your default, you now have this very poorly conditioned posterior chain, which then transfers into you not being able to default maintain neutral spine positions, and the domino effect proceeds to the point of inflammation, structural breakdown, pain, and disability.
And for our listeners, David, in layman's terms, can you explain posterior chain and what the issue is there?
The posterior kinetic chain is just a soft tissue structure of ligaments, tendons, and muscles that runs from the sole of your feet all the way back up your calves, the back of your thighs, your glutes, up the pelvis, up the back, up the neck, and then it stops at the top of the head. And it is, I can dissect that out of a cadaver. It is a real musculoligamentous structure, musculoligamentous and tendinous structure that is like the rubber band for the movement of your skeleton. And if you have a really healthy posterior kinetic chain, it's this rubber band of potential energy. Okay, and when we move well, that rubber band is tight and powerful and elastic, and it allows us to do incredible things like 200 kilo deadlifts and squat snatches and squat cleans and all that stuff that you guys talked about in CrossFit, which is why I love the sport of CrossFit, because it sort of inadvertently applies those principles that make my patients have healthy spines. CrossFit says that they are a strength and conditioning program, and I say that it sort of is, but it doesn't know that it is also a movement proficiency program.
And it's also a sport. It's also a sport,
yeah,
which is, I think, where some of the challenges come from there. But a lot of my haters, I suppose you could call them, would say, "Oh, you're just teaching CrossFit." I said, "Well, we're not actually a gym. I don't actually refer to our place as a gym. I refer to our place as a movement proficiency centre, a functional movement proficiency centre, and that's the imperative. That's the discriminator that determines whether you're going to recover from back pain or whether you're going to develop back pain. Is do you have movement proficiency?" And that's sort of not in the textbooks, I must say. It's not in the textbook. Whereas CrossFit is taking it to the next level and saying, we're a strength and conditioning program. We're going to make you the fittest on earth. Yeah, and that's the sport aspect of it, really.
Yes, that's the sport. That's like the pointy end of the spear. And why can CrossFit make someone the fittest on earth, whereas triathlon can't, whereas running a marathon, running a sprint can't? Because CrossFit's foundation is those movement proficiency points that we talked about.
I love your. Sorry, Dave. There's just a bit of a lag on the old good old internet. Maybe in the hospital there, they're.
No, mate. I'm in the middle of Brisbane City, and I've still got to use mobile gear. If I plug into a wall, you wouldn't be able to hear me at all.
Yeah. But I love your axiom, the sport of life, because but basically it makes us all athletes, and I love my CrossFit and I love the sport of CrossFit. But for me, as a middle-aged man and a dad and someone who's fairly active, and I like getting outside and hiking and riding my motorbike and trail running and climbing mountains and digging in the garden. I love what my work in the gym, in that functional movement side of things, allows me to do with zero pain. I can pick up things twice my body weight, and I can do all of that without buggering myself and ending up on the couch for 4 days afterwards. So it transfers into everyday life.
Absolutely.
And I think for our listeners, it's, they do work hard and they have physical jobs, and there's lots of movement throughout different planes that are really, putting them at greater risk of those, those injuries, I guess, and all of those micro traumas as you talk about. So are there some simple things that our listeners can pay attention to or change that might, set them down a different pathway so they don't end up coming to see you for a disc fusion?
Okay, well, I can see, let me put it to you this way, Warwick. If you just say you had two people, you've got a brickie and you've got a bank manager, okay? And the brickie's got to heave a ton of bricks every day, 5 days a week, okay? And then you've got a bank manager who sits in an office and he's just got to shuffle his papers around and go into get stuff out of cupboard every now and then. Every hour he's got to get a file out. Let's presume that both of those people move well. Okay, so they're both moving really proficiently. Mm-hmm. Who would you rather be in terms of developing functional capacity?
I'd rather be the brickie.
Exactly, because neither of them are going to get injured, okay? Neither of them are going to get back pain, but who's going to have the greater functional capacity, the brickie or the bank manager? Obviously the brickie. Yeah. Because it's a bit like he's going to the gym 16 hours a day.
Yep.
Just doing his job. Now, the bank manager is going to be absolutely hunky-dory as well, but his functional capacity is going to be down here, and the brickie's functional capacity is going to be up here.
Yeah.
So the message that we want to get to your listeners is that don't think that because you've got a physically demanding job, you're more susceptible to those injuries. Okay, so that's where we come back to the discriminator. In fact, I would rather have a physical labour job move proficiently because I'm going to look like Tarzan.
You already do, mate. I'm going to put a photo of you at a comp with your shirt off.
But if I'm a bank manager, I'm going to look like a bank manager. Both of them need to move well, right? So and you can see the tradies that move well. You know, when you're driving down, the tradies that move well are just solid, and they have that CrossFitter's physique because they move well. But the tradies that move poorly, they're broken down, and they blame the work as being the cause for the breakdown, and it's not the work, it's the fact that they did that work with poor proficiency, and that poor proficiency translated into their home environment as well. So does that unravel that question more in a more precise way, Warwick?
Well, my distillation of that is it's not the work they're doing, it's the way they're doing it.
Yeah, exactly.
And so the simple changes would be to learn how to move the way our bodies are meant to, and stop looking at the work safe lifting brochure because it's not true.
Right. And I think embrace the fact that you've got a physically demanding job. Okay, embrace that fact that you've got to lift and hammer and pull out tree stumps. Do it well, and your capacity is going to be huge, and you're going to have a healthy, robust spine. You're never going to have back pain. You might get tired.
Yeah.
Okay. You might get tired and might suffer muscular fatigue, but that's your body's response to working hard.
Yeah.
That doesn't equal injury. So if we do a heavy workout and we go home tired, I feel fantastic. I am wrecked. I'm on the ground looking at the ceiling going, holy shit, what was that? But I feel fantastic. And I recover the next day just through normal rest and recovery, and I hit it again. And so that's what a good tradie's doing is he's working efficiently, he's working proficiently, and he's resting at night, and he's becoming Tarzan by going to work. Whereas poor old bank manager is just sitting in his office. He's okay, he's happy, but he's never going to be Tarzan.
or he's spending hundreds of dollars a month and hours grinding away in a gym trying to create that same functional capacity. You got it. That's exactly right. And that's what I do. Like my life. That's what we do. So we have to pay a gym membership to maintain that little trying to get Tarzan into our day. Yeah. Okay? Or Jane. The work hard. Yeah, the tradie's lucky. The tradie doesn't have to pay for a CrossFit membership. He's doing it every day for 12 hours and building up that adaptation steadily over time. So I think Nick's got a question.
So my question is that, well, it's not a question, I guess I'm asking for an affirmation. Kids are born with the ability to move functionally, aren't they? And somewhere along the way, it goes wrong.
Yep.
Absolutely.
So where does it go wrong? What can we do with our children even to make this better?
Well, I love it when patients with back pain come and see me and they drag their little toddler in. They've got their little toddler. And I do this quite regularly where I'll put down something at about knee height, just like on the edge of the chair. It'll just be like a mobile phone or something. And I get the patient to pick it up, and they do it. And then I get the child to pick it up. And the child just does this perfect hip hinge or this perfect squat, whereas the patient, the adult, will do this weird Sydney Harbour Bridge kneel, something like that. I say, look, why do you think your little baby picked it up completely different to you?
Yeah.
And the child has not been exposed to modern society's domestic cage.
Yeah.
Okay. So we living in this domestic cage that actively corrupts our movement proficiency. And we actually know this if we look at societies that are non-industrialized, their incidence of musculoskeletal disability is almost zero.
Yeah.
Gosh.
Hip replacements, knee replacements, pain, back pain, it just doesn't exist there. The Africa, northern China, Malaysia. When you go to Malaysia, you still have to squat down to use their toilets.
Yep.
Yeah.
So they actively maintain movement proficiency throughout life.
Yeah.
Whereas in Australia, we don't even walk upstairs anymore. We go to a shopping centre. What? This shopping centre has no escalators? Can you believe that? Can you believe a Westfield shopping centre that didn't have escalators? and that if we bought a suitcase that didn't have wheels, you wouldn't pay for it, right? Because modern society is just embedding in there the corruption of movement proficiency.
Yeah.
Yeah.
And so it's just so clear to me when you understand. It's like the jigsaw puzzle pieces in my latter years of medical practice they're all just coming together for me now, and so that's allowing me to see the clear picture.
So I guess people are going to be listening to this right around the country, and they're not all going to be able to get to Brisbane to work with you and the team there, David. If someone is listening to this going, yeah, I know, I need to do some work on that. What should they do next? What are some good steps for them?
We're always happy to help people. And we do have, in terms of actually receiving our NeuroHab program, which is dirt cheap, by the way. It's not a money making scheme. It doesn't make me any money at all. It's a service that I need for my surgery. Obviously, surgery makes me money, but in terms of the rehabilitation, that doesn't make me any money. Because a lot of people say, "Oh, you're just doing this to create more wealth." It's not. If I'm going to be a surgeon, this has to be part of my surgery practice, right?
Yep.
We do have centres in Bundaberg, on the Sunshine Coast, and in Brisbane. So there are 2 centres. There are 3 centres that deliver the specific NeuroHab program, which is an 8-week program.
Yep.
But we get calls from people all the time, just from word of mouth. Friends of friends just will jump on Facebook and look up Functional Movement Training Centre, or they'll jump on our website and send us a message. And often, if people can spend just a little bit of time with our coaches, they don't need to spend the whole 8 weeks. But we often will customize a bit more of an intensive program for them. So instead of coming 2 times a week for 8 weeks, we might see someone Monday, Wednesday, Friday for 3 weeks.
Yep.
Or Monday, Tuesday, Wednesday, Thursday for 2 weeks. And that's often enough to allow people to now understand, or give them the tools to then be able to continue to eliminate their movement dysfunction and build capacity, and therefore eliminate their low back pain. Because once you've got the foundations, you just keep getting better. You don't sort of go backwards as long as you don't let that modern society creep into your lifestyle too much again.
Yep.
It's like if you went and got 8 weeks of golf lessons, and you had a good golf coach, and from day one you couldn't hit a golf ball, but you then got the 8 weeks of lessons or 3 weeks of lessons or something, and then you never saw that golf coach again. But a year down the track, you're going to be a pretty good golfer, okay?
Yeah.
Because you've applied those principles that you were taught, and 3 months later you're okay. 4 months later, you're better. 6 months later, you're better. 12 months later, you're better, because you just kept practicing those points of performance.
Yep.
And so that's why your handicap comes down, because you're practicing movement points of performance that were guided to you by the golf coach. And we can do the same with patients. We can give them these movement points of performance that they then go and practice, and then they've got the tools to just keep getting better by themselves.
Awesome.
And that's really important.
So I'm assuming you're online, David. What's the best place for listeners to go stalk you?
Probably the best place to touch base with us is through the Facebook page. And the Facebook page is Functional Movement Training Centre.
Cool.
For specifically the spine. Obviously we've got City to Coast Neurosurgery is my surgical practice. But in terms of what your guys are going to be most interested in is going to be, how do I recover from a bit of back pain, and how do I avoid surgery?
Yeah.
You don't want to see me. You want to see my movement therapist. You don't want to see the mechanic. You want to see the driving instructor.
Yeah, that's right. Stop running the car into the curb and breaking the wheels.
Yeah, I'm the mechanic. My coach is around the corner there. They're the driving instructors.
Yeah, nice. Well, definitely go check it out, listeners. I am a big believer in prevention over cure. There's not as much money in prevention, which I think is sort of the understory here with talking to you, David. But certainly there's a lot of benefit there for those of us who actually want to put the work in. So, mate, thank you for your time today on the podcast. Really appreciate you having a chat to us. I know you're a busy man there. And
thanks, Dave.
We will put all the links in the show notes.
Great chatting. And if your listeners have any questions, just tell them to email it in, or just jump on the Facebook page, and I don't know, you can sort of send questions on the Facebook page. And I'll be more than happy to answer them, because it always strikes up a lot of questions about back pain, because so many people have it and they've been given so much information. And I said, but my physio said it's because of my disc bulge, but my so-and-so said it's because I got weak core. And we can very easily impart logic into that thinking.
Awesome, mate. Love it.
Okay, guys.
Thanks again, Dave.
Thanks for chatting, guys. I got to catch up, Warwick, in the near future.
Yeah, we'll have to do a comp together one day, mate.
Come up to the mountain to come to the frontier.
The Toowoomba studio.
Okay.
Thanks,
Thank you,
Dave.
guys.
Thanks, Dave.
Ciao.
You've been listening to the Tradies in Business podcast with Warwick Bidwell and Nicole Cox. Find out more about today's guest, tools for your trade business, and other cool stuff at tradiesinbusiness.com.au.